Signs of vitamin B12 deficiency you should never ignore. Vitamin B12, also called cobalamin, is a water-soluble vitamin that helps your body make red blood cells and keep nerve cells healthy. Unfortunately, our body is not capable of making B12, and we need to get it from animal-based foods or supplements. Since B12 deficiency has some vague symptoms, it can easily be ignored. It can affect anyone, so whether you're feeling off or just curious, stick around. But before we jump into the top symptoms, be sure to hit that subscribe button and ring the notification bell so you will never miss our health and wellness content. Now, here are signs and symptoms you will experience if you are suffering from vitamin B12 deficiency. Fatigue and weakness. Weakness and fatigue are common symptoms of vitamin B12 deficiency. Since your body doesn't have sufficient vitamin B12 to produce red blood cells, your body lacks an adequate supply of oxygen. As a result, you feel weak, exhausted, and tired. This is not normal fatigue. If you constantly get enough hours of sleep and are still tired, you might be suffering from vitamin B12 deficiency. Another sign is pale or jaundiced skin. Vitamin B12 plays an essential role in the production of DNA needed to make red blood cells. Without it, cells do not get correct instructions and are unable to divide and form properly. This causes a type of anemia called megaloblastic anemia, in which the red blood cells produced in your bone marrow are large and fragile. This makes them too large to pass out of your bone marrow and into circulation, which reduces the amount of red blood cells circulating around your body, which means less circulating oxygen and hence pale skin color. Also, due to fragility of these red blood cells, many of them break down, causing an excess of bilirubin. Bilirubin is a slightly red or brown colored substance produced by the liver when it breaks down old blood cells. Large amounts of bilirubin are what gives your skin and eyes a yellow color, a condition known as jaundice. Next, we have shortness of breath and heart palpitation. Low B12 levels can lead to a reduction in red blood cell production, resulting in shortness of breath and heart palpitation or irregular heartbeat. This mostly happens if you have become anemic. Fortunately, this symptom is reversible by taking B12 supplements or eating foods that are rich in B12. Our next symptom is numbness or tingling sensation. Vitamin B12 is essential for maintaining healthy nerve cells. When you are deficient, you might experience tingling or numbness, often in the hands and feet. This is because B12 is very important for your body to produce myelin, a substance that surrounds your nerves as a form of protection and insulation. Without B12, myelin is made differently and your nerves are not able to function normally. Unfortunately, this symptom of B12 deficiency overlaps with symptoms related to diabetic neuropathy, a nerve damage caused by high blood sugar that can cause pain and numbness in the extremities. People with diabetes taking metformin are at higher risk of developing B12 deficiency because this medication can reduce vitamin B12 absorption in your body. Therefore, a B12 deficiency could be misdiagnosed as peripheral neuropathy in people with diabetes. So, it is recommended that people taking metformin get screened for B12 deficiency. Next, we have difficulty walking or balance issues. Your nervous system can suffer when B12 is lacking, causing difficulties with balance and coordination. This might make walking and even standing a challenge. This is often seen in diagnosed B12 deficiency in people over 60, as they are prone to B12 deficiency. The good news is that preventing or treating deficiency in elderly may improve mobility. Next, we have inflammation and pain of the tongue and mouth. This is due to a condition called glossitis, where your tongue becomes inflamed, red, and painful. Also, your tongue will become smooth and taste buds will disappear. This can affect speech and your ability to taste. You can also have stomatitis, which is characterized by mouth ulcers, feeling of pins and needles in the tongue, or burning sensation in the mouth. Another symptom is vision changes. Vitamin B12 plays a role in maintaining healthy optic nerves, and severe deficiency can lead to optic nerve damage and can plug up blood vessels directly in the retina. This can cause blurry vision, double vision, and vision loss. If you begin to feel like you can't see that well, do not wait. Go see your doctor. The good thing is that this symptom is reversible by taking B12 supplements or eating foods that are rich in vitamin B12. Next, we have headache. Headaches are among the most commonly reported symptoms related to B12 deficiency in both adults and kids. According to a study done in 2020, headaches were the most common symptom of vitamin B12 deficiency in adolescents. Also, other research has shown that vitamin B12 might help treat chronic migraine. Next, we have cognitive impairment. Low B12 levels have been linked to cognitive issues, including memory problem and difficulty concentrating. You may feel like you are in a constant mental fog. This is due to insufficient B12 to make red blood cells, which leads to decreased amount of oxygen in your brain. Studies have associated low B12 levels with worsened mental function in older adults, but the mental impairment can improve with B12 treatment. Next, we have mood changes. B12 deficiency can lead to mood changes such as depression, anxiety, and irritability. These emotional shifts can affect your overall well-being. Vitamin B12 helps break down a sulfur-containing chemical called homocysteine found in your brain. Therefore, having low B12 levels can cause elevated levels of homocysteine, which could lead to mental health problems. It is important to note that changes to mood and conditions like dementia and depression can have a variety of causes. Therefore, the effects of supplementing alone in these conditions remain unclear and are not recommended. If you have a deficiency, taking a supplement may help improve your mood. However, it is not a substitute for other proven medical therapies in treating depression or dementia. What can cause vitamin B12 deficiency? Vitamin B12 deficiency is caused by not eating enough of the animal products, which is common in vegetarian and vegan diets. It can also be caused by compromised absorption, which can be due to medications such as metformin, chemotherapy, or diseases such as pernicious anemia. Also, as you get older, your body's ability to absorb vitamin B12 decreases. Remember, these signs can be subtle and often overlap with other conditions, so it's essential to consult a healthcare professional if you suspect you might be deficient. Thank you for watching. If you found this video helpful or know someone who might benefit from it, please share it. And if you have any questions or personal experiences to share, feel free to drop them in the comments below. Until next time, stay healthy and remember, health is the greatest wealth.